Hey guys, it's Dr. George here, and today I wanted to give a brief response to the television show Ask the Doctor released by the ABC here in Australia. As part of their series, their final episode was about sex and sexuality. The final section of the TV show talked about rising STI rates, in particular chlamydia, gonorrhea. It was a little bit alarmist, but it is true that the rates of these STIs have been on the up and up. They do talk briefly about HIV and how it has stabilised within Australia. What does disturb me though is that the advice that was given that the only way to prevent STIs, avoid STIs, was to be using condoms. And I would put it to you that this argument is not 100% true. And the reason for that is that condoms do not absolutely prevent STIs. Condoms can in fact reduce the chances of STIs. However, it does not eliminate them, and that's because condoms are purely a barrier method. And we know that the vast majority of Australians do not use condoms for all forms of sexual activity. That includes things like oral sex in both directions, from male to female, female to male, male to male, male to male, female to female. You get the idea. People are not necessarily whipping out condoms for that sort of sexual activity. However, we know that STIs can be transmitted that way. Other important data that was neglected is the fact that some STIs, in particular gonorrhea, can easily be transmitted through kissing. This is new data released by the ASHM people at their conference in 2016. I'm not quite sure how a condom is going to help prevent that. Here's the point. The key factor to reducing the rates of STI transmissions is to get tested. If you are having regular sex, it's important that every year you get a full sexual health screening. If you've had more than 10 partners in less than 6 months, you should be getting a screening every 6 months. If you're particularly successful, or if you are on medications like PrEP, then it is absolutely worthwhile to get a screening every 3 months. It's also important to know all of your options when it comes to preventing STIs. This includes medical interventions which are now available, including things like PrEP, pre-exposure prophylaxis, a medication when taken every day that can reduce the risk of HIV infection by 99%. This is a fantastic innovation, and I'm surprised that it wasn't even mentioned on the show. So guys and girls, if you wish to help reduce the amount of STIs and to protect your own sexual health, it's important that you know your status. So the way to do that is get a full sexual health screening on a regular interval that's appropriate for your level of sexual activity. If you feel that you are at risk for some additional things like HIV, talk to your doctor about the options that are available for you, and be aware that while condoms are great and condoms do reduce the risk of STIs, they absolutely do not eliminate them. So be sure to get a regular checkup, and if you notice any symptoms, rashes, sores, discharges, pain, anything that's unusual, see your doctor early. Get it diagnosed, get it sorted out, and if required, get it treated. But it's important that we are aware of all of the options when it comes to our sexual health. Please, I urge you to pass this on. People, know your sexual health, get tested, and get responsible for your own sexual life.